Hey guys, it's Dan Sfera here again, and welcome back to theclinicaltrialsguru.com. I got a question in regards to sponsor audits, okay? And this is something important. As a clinical research site, you're eventually going to get an audit, okay? So sponsor audits are usually triggered by a few things. Number one, you may be just a high enroller, and the sponsor wants to make sure that your site has everything in order should the FDA ever come audit your site. Okay, another reason is the sponsor may think that there's something fishy going on at the site, or you just have a lot of queries and a lot of issues that they're noticing from your site, generally triggered by a lot of queries, or more queries than other sites. So during a sponsor audit, here's some interesting things that sponsors are cracking down on in response to the FDA cracking down on these things recently, and this is as of October 2014. So the first thing, one of the major things that sponsors are looking at is they're looking at your SOPs, okay, your standard operating procedures. And it doesn't matter what the FDA regulations are. Let's take, for example, calibrating your equipment, okay? So the FDA regulation is they got to be calibrated once a year. Now, if in your SOPs it's written that they're calibrated quarterly, even if you're following FDA guidelines and calibrating them once a year, because your SOPs say quarterly, you're not following your own SOPs. This could be a finding that the FDA has, because the FDA is going to hold you accountable to your own SOPs, okay, and so will a sponsor. And there's other things like this, like there should be a process of calibration that's documented in your SOPs, or at least you should have it on file, where it shows how every equipment is calibrated. And if you don't have this, I would suggest you contact the manufacturer for every piece of equipment you have in your clinic that can get calibrated, and have them send you their process for calibrating the equipment. Now, if it's a brand new piece of equipment, you usually don't need to have it calibrated. There's a certificate there. So hopefully this helps answer some of your questions on calibration and on SOPs and sponsor audits. Thanks a lot, and check out theclinicaltrialsguru.com. Email me, Dan, at theclinicaltrialsguru.com anytime. Take care.